Welcome to SKK classes again. So today I'm going to discuss about one of the special topic, and it's a very much important in relation to hospital or related to some patients, and this topic is known as hyperkalemia. Okay, now what is actually the hyperkalemia is, and what are the main sign symptoms if the patient is suffering from hyperkalemia, and why it happens so, means why the potassium level gets increased in our body, and what are its management. So for now the question arises, what is actually a hyperkalemia? So hyperkalemia is a just type of condition in which the potassium level in your body get increased suddenly. Okay, and the normal value of potassium is just like a 3.5 to 5.2 milli equivalent per liter. But if this value is increased, means the potassium level in your body increased more than 5.2, then it is known as hyperkalemia. And if its value decreased from 3.5, then it is known as hypokalemia. But today we will discuss about hyperkalemia, because it's a life threatening condition which can occur alone, which can also occur with some underlying disease condition. If the suppose if the patient is having some diabetes mellitus, or patient is having some cardiac problem, or any injury that causes bleeding, so in that condition patient can get hyperkalemia. And even though some patients like who are having a kidney disease or going through dialysis, those people can also suffer from hyperkalemia. And it's a very life threatening condition, and its management is required on the spot or suddenly. Okay, now let's discuss what are the main causes of hyperkalemia. That what is the reason behind that the potassium level of in our body get increased suddenly. So the main causes are, I have made one word, that is frames. Okay, frames mean F refers to failure, that is renal or kidney failure. R refers to rhabdomyolysis. A refers to addison disease. M refers to metabolic acidosis. And E refers to excess administration of potassium in the body. And last one is your spironolactone and tissue injury followed by blood loss. Okay, so let's discuss the first part, that is the first cause of hyperkalemia. First one is the renal failure or the kidney failure. So what will happen in the kidney failure? If the kidney failure is there, then what will happen? The body will start retaining the potassium, okay, in it. And because if the kidneys are working properly, the extra potassium automatically gets get excreted from outside the body. But if kidneys are not working properly, then a lot of chances are there that body will start retaining the potassium. Okay, because all of you know that nephron, that is a basic unit of our excretory system. Okay, and nephron is having a various parts, like collecting duct is there, Bowman capsule is there, DCT is there, PCT is there, loop of Henle is there. So the extra potassium, if it is present in the body, that will be excreted outside by the body, because the absorption of the potassium that will takes place in the DCT, means distal convoluted tubule of the nephron, which is the basic unit of the kidney. So in this way, if the renal failure is there, then 100% chances are there that patient must have a hyperkalemia. Okay, and the next point is your rhabdomyolysis. Now, what is actually rhabdomyolysis? Okay, listen, rhabdo, okay, that refers to red color. And myo words always refers to muscles. And lysis always refers to breakdown. So if any type of traumatic injury is there, means if the patient is having or coming in your hospital with some trauma or with some muscle injury, so what will happen? the myoglobin, there is a one pigment which is known as myoglobin, and this is a present in the muscles of the in our body. And if this pigment if the muscle injury is there, then this pigment will be secreted in a large amount, and this pigment, or you can say the myoglobin, has a direct damage effect on the kidney. Means this myoglobin is having a direct damage effect on the kidney. So extra myoglobin, that will damage the kidney, and the kidney failure will be there. And if the kidney failure will be there, then there is no proper functioning, and the body will start retaining the potassium. Okay, so this is the main cause that of the you can say hyperkalemia. And in rhabdomyolysis, there is if the kidney failure is there, okay, so kidney will start producing red color urine, or in medical language you can say that the hematuria is there. So if the patient is having a hematuria, so doctors always assume that there is something problem with the kidney, and they will ask you or told you that to go or give directly, they will start the you can say treatment of hyperkalemia. Okay, and this is the second cause of hyperkalemia, that is rhabdomyolysis. Then third cause is Addison disease. Now, what is actually Addison disease? Addison disease is a disease in which the suprarenal glands, they will not function properly. Now, what are suprarenal glands? These are the glands which are present over the or on the upper side of the kidney. Okay, there are, and these are also called as renal glands, and they produce two types of hormones. Number one is cortisol, and number two is aldosterone. Now, what are the function of these hormones? If the aldosterone, like cortisol hormone, this is known as stress hormone. Means if your body is in a stress or in anxiety, then to counterbalance that, our body automatically produces cortisol. But if the suprarenal glands are not working properly, then what will happen? The cortisol will not be produced in the body, and if the cortisol will not be produced in the body, then stress will be there. If the stress will be there, then what will happen? The body will start retaining the potassium. Okay, and in this way the your potassium level, that will get increased in your body. And second is your aldosterone. Aldosterone is also having a direct effect on the kidney, because if the aldosterone is not secreting by properly in the by the suprarenal glands, then what will happen? The kidney failure will be there, and the kidney failure, that will automatically leads to hyperkalemia. So this is the third cause. The next cause is your metabolic acidosis. Okay, now what is metabolic acidosis? I think if you people belongs to a medical group, so you people know very well that what are acids, what are alkalis. Okay, so in the same way, I will because metabolic acidosis or alkalosis, this is a very vast topic. I will not go in too much detail. I will just give you one simple detail. That is the normal pH of blood, that is it lies between 7.35 to I think 7.45. Okay, so this is neutral one. Okay, and if the value of or you can say you can assume just that the pH of the blood is 7. Okay, if the this pH of blood is less than 7, okay, then it means that your body is going into acidosis. Okay, because less than 7 acidosis, and more than 7 it is alkalosis. So if the patient is having a pH of blood less than 7, or you can say it the pH of blood is 5 or 4 or 3, it means your body is in metabolic acidosis. In the same way, if your body's pH blood pH is more than 7, suppose it's 8, 9, 10, 11, so it means that the patient is in metabolic alkalosis. So if whenever any of the patient is the pH of the patient is less than 7, it means the patient is in metabolic acidosis. And if the patient is in metabolic acidosis, it means that the sodium potassium pump, which like our buffer system, that will not working properly. So it means that if the patient is going in the acidosis, the potassium will start retaining in the body itself. Okay, so what will happen in that condition means the water level sodium level is decreasing and potassium level is increasing, because sodium level and potassium, okay, sodium and potassium, these are the most you can say abundant element in our body. Potassium is the intracellular cation and sodium, that is the extracellular cation. Okay, so then these both are inversely proportional to each other. Inversely proportional means that if one element or one element is increasing, the other one is automatically decreased. So if when the patient is in metabolic acidosis, the potassium level will increase and the sodium level will decrease. So that's why doctors always told you to give the sodium bicarbonate, okay, or you can say injection soda to the patients. So this is what you can say metabolic acidosis. And the next point is the excess administration. Now, what do you mean by excess administration? Excess administration of potassium means if you're taking like a high potassium diet, so it automatically increase your potassium in the body, because we have to take everything in balanced manner. Okay, so if your diet containing too much potassium, so your potassium level automatically increase in the body. Okay, and you will acquire hyperkalemia. And last one is the spironolactone. Okay, this is a drug which is used to control blood pressure, and this can also leads to increase in the hyperkalemia. So these are the main causes which can cause hyperkalemia. And one thing more I would like to clear here, that if the person is suffered from hyperkalemia, so lot of chances are there the patient can get arrest at any time. Okay, because hyperkalemia or you can say the high potassium level is, if it's there, it's having a direct effect on the heart. Okay, so these are the main causes of hyperkalemia that we have discussed now. And what are the main signs, symptoms of hyperkalemia, and what the main treatment that is always given to the patient if the patient is having hyperkalemia, that we will discuss in the next video. Thank you for watching SKK Classes NZ.